before we get started, I just want to take a minute and acknowledge Emids. I don't know if you guys are having this experience, but to me, like this event is like the living embodiment of what it's like to work with Emids, because it's smart, hard-working people coming together to solve really hard problems in healthcare, maybe with a sprinkle of fun too. So let's thank Emids. So this panel is all about Techquity, technology plus health equity, and the idea that technology can be a conduit and not a barrier. And what would that look like? So I think it'll be a really good discussion. I'd love you guys to introduce yourself, but also take a minute and say, why do you think this topic really matters? And maybe I'll start just to say sometimes it gets really personal, because for me, I'm on the national board of the March of Dimes, and so much of what we do at the March of Dimes is focus on health equity, maternal and children's health. So I'd love to hear for you why this topic really matters.
Well, great. Zane Burke, CEO of Quantum Health. Quantum Health is the original healthcare navigation. We help over 3 million members, 500 different self-insured employers today, driving hard ROI. In fact, we just released our study today with 3-to-1 ROI in year 1 and 5-to-1 in year 3. So we're super excited about that. But it's about the ROI and the outcomes at the end of the day.
Feel free to tag him on LinkedIn if you want. Right?
Love to do that. But this is, you said it exactly right. Healthcare is intensely personal. Yeah. And none of us actually want to be a consumer of healthcare really at the end of the day. All of us are trying to do healthcare for other reasons. So whether it's, spend time with your family, friends, drink a glass of wine, whatever it is that turns you on, that's why we do healthcare. And I think the Techquity piece is about enabling people to live their life the way they really want to do it, because they're not going to be consumers at the end of the day. We've got to figure out how we reach all those people as part of that.
Thanks, Zane. Eva?
Excellent. Hi, everyone. I'm Eva Borden, and I'm the president of Evernorth Behavioral Health. So Evernorth is the health services arm of Cigna. And when I think about, particularly with this topic, for me, behavioral health is incredibly important. And the marrying between behavioral health and technology is critical. And so when I think about why does this topic matter, there's 2 points. One, without technology, we will not crack the code on measurement-based care for behavioral health. It is way too much and has been a black box, and we have the opportunity to change that. On the other side, from an intensely personal point of view, I have a daughter who has really significant mental health needs, and so I live as the consumer of this space all the time. I live in a really rural area. If it wasn't for technology enabling access to care, I don't know what we would have done. And so when I think about the importance of this topic, this is the transformational part of making sure that our children, our workers, and everyone else can actually have a really productive future.
Hi everyone, Jessie Beegle. I'm the Chief Innovation Officer at LifePoint Health. LifePoint spun out of HCA about 25 years ago. We were originally all of the rural hospitals at HCA. We have been growing and diversifying over those past 25 years. We have 62 hospitals, 62 rehab and behavioral facilities across 32 states, and super excited about this this topic because I've worked at some of the best technology companies in the world with some of the smartest people out there solving really hard challenges. And when you think about the ability to access those technology and those solutions, like it's really something very personal for me to ensure that they're not just going to, the big academic centers or the big cities, but they're going to Main Street and they're getting to the people that actually need them at an affordable cost. So excited to be part of the conversation.
Thanks, Jessie. So let's go right there first, because as you think about then engaging members, the people that we serve, and especially people who might be underrepresented or people who might have health equity challenges. So maybe you can kick off talking about how you think about engaging members or leveraging technology.
Well, I think it's really about, you have to meet people where they are in their life flow. Yeah. And so part of this is how do you think about, where I started with the consumer side of this, none of us want to be in healthcare. How do we reach out and get to them at the right time? So how to use the data science, how to use the consumer economic elements to get to know you, so that unlike your engagement with, if you call the airlines today, they won't know who you are, they won't know your flight, even though they should have all that access. We've got to be better at healthcare about how we use all the data out there to make it personal and engage with them on a personal basis. And that's what we do at Quantum Health, is what we're trying to do is actually connect in their life flow and be that connective tissue in a super confusing environment.
Yeah, Eva, I know you had a really good quote on this. Was it something about the door?
Yeah, so I think when I think about when I talk with different employers, I think everybody is looking for the proverbial front door. If only I had the front door, I'd have all the solutions. And my hypothesis is, if you have a house that only has a front door, you have a fire hazard. And so there have to be multiple ways that people are accessing care and finding them. So like if I back up on the behavioral health side, the gap between the onset of the average symptom to getting care is 11 years.
Wow.
So imagine 11 years struggling, wandering, wondering how to get help, assuming you even realize you need it. So when I think about finding different ways, it's to your point, using the data and the analytics to identify, listen for what those things look like. And it's meeting people wherever you find them. So I'll give you one example. There was, I ended up getting a letter from someone on our, from a customer, and she explained the fact that she had had uterine cancer. And as she had gotten to the point that from a medical point of view, she was ready to be let go. She was physically fine. But working with one of our own clinicians, the clinician said, you know, I really think you'd benefit by working with one of our colleagues. So she got transferred over, and the letter read something like this. If it wasn't for spending time with the person in the behavioral health space, I would have never gone again to get another cancer screening. Because what if they told me I had cancer? I would have never been able to show up at work again the way I do now, because now I know how to come out with who I am. And so when you think about these things, it's not just a matter of, yes, finding them, using the data, but when you actually get to drive these changes and you cut down the 11 years to much less, you can actually have a major impact on people's lives.
It's an amazing story. Jesse, as you think about leveraging technology and engaging members, so you're LifePoint now, but you were Google. So I think about Google search, and I'd love to hear your perspective on that.
Yeah, it's funny when companies pitch us that they're the digital front door. It's like, have you been to Google at 2 a.m.? Like, I'm joking, but I think one of the things that's really interesting, having spent time at Google, I was at Amazon before that, just kind of looking at how technology companies think about healthcare and think about the space. And at the heart of it, Google is an information company, and they do an amazing job when you think about all of the information that's out there on the world, that is on the web, that is indexed. And yes, they still have a ways to go, and they've got a wonderful team working on that to like really ensure that when someone is looking for information that can help them get to that next best action in their health journey, that they're able to do that. And so the team that I got to work on that was quite a privilege, especially during the pandemic, which was a whole nother story. But when you think about what Google does really well, one of the things that I've really taken to heart as I've come to the delivery side of healthcare is language really matters, and we can have the best information, the best technology readily available in every household out there, but if someone doesn't fundamentally understand what you are serving them, they can't really utilize it. And so this whole idea of like, how do you make data actionable for that given user, whether it's, you know, a patient, whether it's a nurse, whether it's someone that's part of their care team that's just trying to look out for mom or dad. And that's something that I think that we can really learn from the consumer focused like technology companies that they do really well. And how do you start to weave that into all different facets of healthcare to make people feel like they are a part of their journey and not just being told what to do in sort of a black box experience. I think we've probably all had those experiences, and so that's one of the things that I'm really excited to work with our team to try and like kind of break through.
Yeah. Hey, any comments on that score about the digital divide and the impact there, and if you think Techquity?
I mean, and it's such a problem, and so that's also one of the things that was just so enlightening to me. Is I remember we were doing a study, we were looking at like Android adoption versus iOS adoption, and most people have a phone, but a lot of times people don't have proper broadband connectivity. They may not have other types of access points that are really important. So during the pandemic, when people were talking about virtual care and telemedicine, yes, that's really important, but also outside of that, some people don't have a room that they can go into and have a conversation in private in their own home with a psychiatrist, for example. And so it's not just the technology, it's also sort of the things around their social determinants and their own home. And so when I went to Walgreens, that was one of the things that we were looking at with Walgreens Health, is how could you start to say, we are in most communities out there, can we offer a safe space for someone, not only from a connectivity perspective with broadband, but also like a room where they could have that telemedicine visit, which I think is really exciting to see the retail companies really step in that way.
So yeah, I hadn't even really considered that. So it's depending on your housing situation, if you don't have a private space for a telehealth visit, then it's challenging.
Yeah, I mean, and I wouldn't want to necessarily be talking to my doctor in front of, like, if you had roommates or family members about something very sensitive. And so it goes beyond just pure technology, but also just pure infrastructure when you think about someone's daily life.
Yeah. I'd love to hear more about what each of you are doing now in terms of engaging members and whose responsibility it is to engage members. So maybe Eva, back to you as you think about Evernorth and the responsibility and how you're focusing on engaging members. Could you tell us some stories or what you're up to there?
Yeah, so I think there's a number of different ways that we think about engaging. So I'm going to kind of go back to what we talked about from that early identification. So there are these pieces that we put into play that we have data that can actually help us inform. So imagine this. We can know with about 6 months lead time if a child is likely to be diagnosed with autism.
Oh, wow.
This actually precedes when there's a very predictable pattern that goes into that. And so when you think about engaging, we would never call a family and say, we think your child is going to have autism. Instead, it's light engagement around, we see you're struggling. Back to your point on language. We see that things aren't okay. How can we help engage you? Or on the flip side, thinking about how do we engage the family. So let's take an example of, like in this case, when I think about, there was a family that we were working with, and the way we actually engaged was the child was young, early autism diagnosis, but the way we ended up really engaging with the family was through the mom, who was struggling with a really deep depression. And she was struggling with a deep depression because she couldn't leave her son alone long enough to take a shower.
Yeah.
And so because she couldn't leave her son long enough to take a shower, her marriage was suffering, and he was the one who was employed.
Yeah.
And so it really came to, when we think about engaging, so how do you identify people early? How do you reach out to them with language that matters? How do you partner with providers to make sure that if someone is coming in and saying, I need help through a PCP or others, that we're there to help engage them? So there's a variety of different ways that you can go. It kind of goes back to no one front door. There's lots of ways that we're thinking about partnering across the ecosystem to find people earlier.
And neurodivergence, such a great example of the need for health equity and outreach. Zane, would love to hear from you because Quantum stands for engagement. So what are you up to there?
So we're fortunate. We have our household engagement is 85% on an annual basis, which is kind of unheard of in a digital health environment. And the way we do that is, again, designed to be into the life flow of the member and the provider, because oftentimes we leave that piece out of the mix of how do you put the three stakeholders together, both the provider, the member, and the plan sponsor, whoever that is part of that. And what we do is try to offer value back to each one of those constituents as part of that model. And so, we talk about the use of technology. We know that if you use the term specialist in a conversation, that 90% of the time you're about ready to spend more than $10,000 on a healthcare journey. And so we can use those kind of cues to come back early on and engage and provide value back to that member to say, hey, it looks like your physician has ordered a PET scan. That's a really bad healthcare event that's about ready to happen to you. You're about ready to go on a cancer journey. In all of healthcare, except for if you're in quantum, that hits the cutting room floor. Yeah. So how do we take these cues from the provider when they do an eligibility check to say, hey, is Sue eligible for that PET scan or not? Then that's a pretty dang big health signal that we should bring to bear. So we try to engage in the moment whenever we engage, whether it's through the mobile apps, whether it's through human touch, and ultimately, I'm a huge believer that technology can take you so far, but at some point it's got to be a personal touch at the end of the day, particularly on those complex journeys. And so what we try to do is really, what is the member reaching out for in that moment of need? And then how do we provide value back each and every time? And the same thing goes with the provider. How do we help make the provider a little bit smarter? Because the provider actually doesn't know what's in your benefit plan. They don't know what you're covered by. And so how can we help them be a little bit smarter along the way? So our job is to actually, we simply say provide love and care for members and providers, and then drive the outcomes for the plan sponsor and great experiences. And that's kind of that's how we're trying to give kind of everybody in the dynamic here a little something along the way. And oh, by the way, turns out that's a great business. It saves money for our clients and creates great net promoter scores. And consequently, the engagement comes because it's not somebody dialing for dollars. It's got to be in the life flow of the member as part of the journey.
So it's because you're the connective tissue.
It's that we're the connective tissue, exactly. And how do you bring together the digital health assets? Because nobody remembers which MSK provider they have in their health plan at the right time. Nobody remembers what their network, if they should reach out and get a different kind of network. They don't know those things. They just know they've got either a back challenge, et cetera. And so in those moments, what's their out-of-pocket going to be? Where can they get an MRI? How can they save money themselves? And we really try to bring the value back to that member and help them on their journey. Conservative care or physical care? In-network, out of network. Oh, by the way, if you go down the street, we'll make the appointment. We see that it's down the street. We can save you $1,000. It'll save the plan sponsor $2,000. So those are the kinds of things that we do as part of the journey. Is we've got to provide value and just recognize we're in an environment where, and it doesn't matter what your payment model is, whether it's self-insured employer, health plan, frankly, Medicare and Medicaid, there's a business model for doing the right thing all along, but it's about being that connective tissue.
Appreciate that perspective. Jesse, I made you go back to Google, so come back to LifePoint, because if I have this right, it's, 60 hospitals, 30 states. And so talk to us about that engagement and whose responsibility is it to engage as you think about Techquity?
Yeah, I mean, given our very diverse footprint and the populations that we serve, and again, I'm sure everyone here would agree with this, healthcare is local. Inherently, it is local. So while you have size and scale, whether you're a big tech company, a large insurer, or you're a large health system, healthcare is delivered locally and is very dependent on people. Technology is a wonderful tool. I'm the biggest fan of any type of emerging technology. We can talk for hours on that. But at the end of the day, it's really getting that formula right, which is how do you equip the right professionals with the right tools so they can be supercharged and deliver the care that they need to. So when we look at our population, one of the things that was really interesting for me, women's health is something that's sort of been bubbling up, especially right now. And most of the solutions that are out there in the market are on, fertility. So I'm planning to get pregnant. I want to get pregnant. I am pregnant. How can we support those women? Those are all wonderful solutions that are out there. But one of the things that was really interesting when we looked at our demographics was our patient population skew a little older in most of our areas. And when I started to dig in with the team, we were looking at a couple different companies, but this company, Emids, that we partnered with, we were their first health system partner. Was really fascinating to dig into the data there. So Emids focused on women 40 to 64, so premenopause and menopause. And when we were chatting with the team, and then we brought a number of our clinicians in from across LifePoint, I didn't realize what a big issue this was. And they said, look, these women are not getting care, or they wait 6 months, have a 15-minute appointment with a PCP, and they're misdiagnosed and said, oh, your symptoms sound like you're depressed. Let me put you on some depression medication, when they actually had a hormone imbalance. And, we started to look at the specialists that are in this area, people that focus on premenopause and menopause. I think there are 500 people in the country that actually have a specialty here, and there are
500 in the country?
In the country, and there are almost, I think it's 58 million women that fall into, so when you think about the numbers, most of those clinicians are in private practice, cash pay in big cities, and I can't think of a better example of inequity, right? And so we partnered with Emids to say, how can we bring this wonderful group of folks that are focused on such a big problem, especially for the demographics, in many of our markets and have them be a digital wraparound for our clinicians that are on the ground. So again, supercharging that clinician that is in Paris, Texas, that is in, small town North Carolina, but they have a specialty bench that they can easily call upon and say, for my specific patient, these are the things that I'm really good at, but I now have a team around me that can add that additional support for that patient, and then keep them in the system, keep the patient engaged. And one of the things that's been really exciting to see is these women, like the notes that they send, it's like kind of amazing. People, like, I actually really enjoy speaking with my physician now because they really get what I'm doing. And that's not to like take away from these other physicians that are doing a lot of hard work, but to have someone that has such specialty be able to now be on the ground in these communities where otherwise these women would go without care. So that's one way that we're really addressing this, is saying specific problems in our market and finding the right partners who do certain things that can complement the efforts that we have on the ground.
And because we are playing Emids Bingo, right, you have to use generative AI. I think you had an AI story.
Oh, yes.
A bridge, yeah.
Oh, a bridge. So the other example, we just
Mark your bingo cards.
Yes. Sorry, I hope everyone's playing along. Sue said there were shot glasses at some point.
Parting shots are later.
We were liking the
gonna
shot
kill
glass.
me. Yes, so another way that we're really focused on, enabling people to be, like for what I was talking about earlier, part of the journey and part of their own care. We just invested in a company called A Bridge, and so it is us, Mayo Clinic, CVS. We're really excited about this technology. They've been doing this since 2017, so it's not a brand new company, which is really exciting. But how do you take what happens between a patient and a doctor in that visit, take the headache off of the doctor's plate to have to do charting, but then also say, okay, generative AI is capturing everything that's going on, makes the chart, gives the ability for the physician to just like quickly go through and say, yes, like you got everything, send it to the EMR. But also on the flip side, it makes it available what happened to that patient. So are there any key medications that were highlighted? And then you can actually dig into the application to say, tell me about Lexapro. What does Lexapro actually do? Or you need to do a follow-up for a certain procedure. And let's say that you have someone on your care team, like a daughter or son, who's helping you. Like my mom, for example, I've used this with one of her visits. She can send it to me, and then my brother and I can figure out, okay, how do we make sure she's got the right appointment follow-up, and then any questions like that. It's all in a 4th grade reading language, which was also something I learned at Google. That is the actual language that you need to put things in if you want the majority of people to actually understand. So when you think about what healthcare sounds like, and then if you remember back when we were all in 4th grade a couple of years ago, right, not that long ago, it's just such a big difference. But that's another way that we're using generative AI to support both our clinicians as well as our patients.
Yeah, thanks. So Eva, you said you live rural Iowa. And I think about, is that Iowa, right?
Yeah, Iowa.
I think about
not Ohio, Idaho, Iowa, but
Iowa. Yes. Got it, on it. So I think about health equity or Techquity in rural versus urban, and how do you really engage people who may be even skeptical about care settings? Like, can you share your thoughts about rural, urban, and access?
So I think a couple of things. Technology is so critical in enabling access in areas that otherwise wouldn't have access. So I mentioned a little bit earlier, I have a daughter who has pretty significant needs. For me to take her to see her therapist and her psychiatrist, it was during the weekday, an hour drive in, an hour and 15 minutes of visits, and an hour home. It's like a half day. And thankfully, I had the luxury and the flexibility to be able to make that change, to be able to move my schedule around. A lot of people don't. And so when you talk about finding privacy or ways to handle things, I think about this, so there's the rural piece that it becomes important. There's also a really important privacy piece, because we want to say in mental health, oh, we've overcome the stigma, but the reality is we haven't. And especially as parents, if you have a teenage child who's struggling, or let's talk about something like substance use disorder. So if someone's struggling with alcohol use disorder, do you want your car sitting out in front of a certain meeting? Or do you want to suddenly disappear from work for 30 days and have people talking about you? There are ways that you can actually intervene through technology earlier to get medication-assisted treatment, in order to be able to get the right types of counseling, to be able to maintain that level of privacy should you want it. Those are the things are bringing all of these resources together earlier. And when I think about listening to Zane and Jesse as we talk, there's such this context of convening. There's such great technology out there. And how do we make it reasonable? So I'll end on one last thing, which is, in a lot of times in the medical space, so a number of years ago, I was walking down the road and I broke my ankle. Like, just clumsy, broke my ankle. I knew exactly what to expect. I went to the urgent care, got an x-ray, went on crutches. There was a predictable time pattern to what I was gonna go through. The reality is, and you mentioned this, it's not just behavioral health conditions, it's other conditions. You mentioned menopause. Mm-hmm. And all of a sudden, it's our responsibility to say, how do we take these conditions that people don't understand, where there are better solutions out there, and bring people, connect and convene people into them. So I think whether it's rural, urban, conditions, whatever it needs to be, there's a massive amount of opportunity.
Yeah, I really like your story about the half a day, and not everyone has a half a day. You also had the $30 for gas, and not everyone has the $30 for gas. I really appreciate your story and your willingness to share your daughter's story. Zane, how do you think about this? How do you think about partnering with patient populations to really understand what they need rather than making assumptions about what they might need?
You know, it's multiple elements of this. So first, there's an ecosystem of partnerships that you've got to be willing to bring in, because no one of us can solve healthcare by ourselves, and I think that's the case here. And I think that's one of the interesting parts. It's how you deliver that in that appropriate moment, and how you make those pieces come together. I know that we use the generative AI and those pieces, first off, for our healthcare warriors, as we call our people, because they're warrioring on behalf of our members. And what we do in that case is, again, build up the trust as part of that. So if somebody's engaging with us, we can drop 46 seconds out of the interaction and make it a better experience up front. And so part of this is just making it feel more comfortable to deal with the companies like us, so that they know you. So that's part of what we do to get, again, trust, get to know you, use the generative AI to do that. We're also using the data so that we can really get to some of the pieces that Eva really touched on, as well as Jesse, which is, it's about the condition as much as it is about the social economic elements. And so, some of these conditions are such that they have stigmas. We have a nice note from a client who has a transgendered son, and they had previously been unable to get care and to get the connections that they needed to get somebody that would understand their son's situation, could talk them through that. They'd tried to commit suicide multiple times, so they connected into the behavioral health side. And so when you think about the Techquity piece of this, it's what in this case, it's using some of the information up front to not predispose to think what it is, but might you want a LGBTQ doctor? Mm-hmm. May you have a need to have a conversation with a behavioral health specialist? Those kinds of things we can queue up front as part of, as you think about the technology piece. But again, those need to be delivered by a human at the end of the day. You're not going to do this all through a technology piece. And so what we're doing is really, how do we queue that data up such that our nurses, our healthcare warriors can engage with them and have an open conversation to get to those kind of islands of people that have been left behind, if you will. And that's what I think about Techquity, is really, it's a conversation about, yes, there's the haves and have-nots, there's the rural, there's the urban, but it's also just these islands of people that we have an obligation to touch, because they're going to, one, it's very personal for them. That's right. And they're oftentimes your son or daughter, and how are we going to engage at the person level? And I think the most important part about the technology is you have to know the whole phone book. That's the hard part about what we're doing, is you actually have to know the entire phone book, but then get down to the person level. And it's got to be person specific about what their unique environment is, whether they have a commute problem, whether they can, whether they have challenges getting off work, all those elements. We have to get to those kind of levels to be able to impact at the person level. And I think technology can make a massive difference on that, on solving some of those challenges.
I really appreciated your story about the family with a transgender child, because then you think, how can you really consider healthcare access through a lens of inclusivity, right? And matching the cultural competence. So there's lots of different lenses there. Jessie, I'd love to hear from you in terms of how do you really engage members and really understand what they need rather than making assumptions. Any last thoughts on this?
Yeah,
question?
I think, again, given our wide footprint in our communities, like we're very focused kind of community by community. And so the team works really closely with our folks on the ground as to big issues that we're seeing in the given markets. But I think when you think about anyone who's skeptical of new things, let's be honest, none of us like to change our behavior on anything. So my job's really fun sometimes because that's what I'm supposed to do. But I think it's bringing solutions that actually solve a problem that exists. At the end of the day, that is core to what we're talking about here, which is not technology for technology's sake, not innovation or generative AI for generative AI's sake, but focusing on a real problem in a given market. So the women's health example and like the lack of providers that we had available to the women that we served was something that we saw as a big issue. And so I think it's kind of working across your stakeholder groups in a given community, not just being sort of in the ivory tower of headquarters. And also to Zane's point, really reaching across the aisle. This is an ecosystem play at the end of the day. And it's been nice for me to see like my leadership team has been wonderful to say we are really good at these things. And these are not our areas of expertise, which, let's just be honest, that's a huge step in the right direction that I haven't seen in a lot of companies that I've worked with and for. And so that's, I think, the best place to start is here's what we do really well. Here are the areas of priority that we really want to fix for our communities and for our patients and our physicians. And then how do we go find the right bench? Like I played soccer in college, so I always use sports analogies. But when you think about a sports team, it's not just one player. You have to have the right people staffed across the different positions to win. And that's sort of how we think about it. And I think that we think about that market by market, which is a little bit complicated at times, but you start to see trends and things like that, which has been exciting.
Yeah. So we have a few minutes left. I would love to hear parting shots, not a shot, a parting shot from each one of you in terms of like what should be the big takeaway here? And for me, maybe I'll offer my thoughts first. At Zelis, our focus is modernizing the financial healthcare experience for all. And so it's this inclusive lens starts with our mission. And for all, the for all is not just payers, providers, members, but it's truly for all. It's really that inclusive lens in all that we do. I would love to hear your parting shots, how you think about this important topic.
Again, I think it just comes back to finding the right folks across the aisle that you can work with, solving problems that actually exist, and really proving value to people across like the ecosystem. And I think that that's how you really change the way that people receive and deliver care. And I think it's a really exciting time to be in this space because I do think that you're starting to see the walls drop down a little bit where people want to work and put their hand out across the aisle.
Great, love it.
Yeah. I think something for me that really matters is the fact that we need to be human-centered and tech-enabled. Without technology, we will not be able to solve a lot of the problems that we have. We need to change and use our data and transform them into actionable insights. So data is great, but if we actually don't do something with it, it doesn't matter. I think, lastly, we need to actually make sure we're addressing that full spectrum of care across the entire need and the entire family unit, whatever family caregiving unit might mean to you. If we do that, I firmly believe that will ultimately save our entire US healthcare system a tremendous amount of money and transform our society.
Zane, last word.
I love it. So I look at this and say it's got to be about transformational experiences in healthcare, which I think people are afraid to use those terminology to say a great experience at the end of the day, creating a different kind of engagement. And to do that across the constituents, you have to provide value back to each one of those members. So if it's a member, if it's a person, first off, they want to be people. They don't want to be a patient. They want to be a person. We all want to be thought of as who we are as individuals first. And so what's the things that enable me so that I can live my life at the fullest? So I've got to provide value back to the person level and include them as part of the journey. On the provider side, we've got to make it easier for them to actually provide care. We make it incredibly challenging, both from everything that around the reimbursement models to how we connect to it's just got to be incredibly hard to be a provider and do that work. And there's got to be more value back on that side. And then finally, to the people that are footing the bill, what happened to the outcomes, both from an efficiency and effectiveness perspective for the people that they're sponsoring at the end of the day? What are we driving back to them? And I do fundamentally believe that the technology can drive different kind of experiences, engagements, and outcomes at the end of the day, ultimately with the human touch. Because it is healthcare, because it's intensely personal, you've got to provide that critical human touch at the end of the day, but use the technology to get there.
Great way to end. Thanks for the stories and the information and a dose of inspiration here. Will you please join me in thanking the great panelists?
Thank you, sir.
Yeah, thanks.